Good evening, everyone. Thank you for joining me as we continue our international tour on COVID 19, speaking to experts in different parts of the world, getting their perspective, hearing about how COVID has been managed and the challenges that they're facing. Today, we're speaking with another doctor from Malaysia, Dr. Roland Victor. And he has been challenging some of the issues around COVID 19 and the vaccination program. So you can imagine the kind of trouble that he may be getting into. But more importantly, it's useful to get his perspective as to what is happening in the country, what has happened, where they are going, and what we can possibly learn from all of this. So without further ado, let's add in Roland. How are you today?
I'm good. I'm good. Good morning, Philip. It's almost early morning here in Malaysia.
Yes, not to worry. Yes, yes, yes. So listen, Roland. I just wanted to try and understand a little bit more about yourself. Tell me a little bit about you.
Okay, so I'm a medical professional. I'm a medical doctor who practices general medicine with a key interest into hormones and nutrition. So my practice is more than 10 years in Kuala Lumpur. It's called the KL Sky Clinic. And I've been in service for the past 16 years as a medical professional in Malaysia. And one of the pillars of our practice is to actually educate the public into preventive medicine. And during the pandemic, I think preventive medicine was one thing that we saw was very necessary for the public to understand what was going on and what they needed to do to actually improve or enhance their immune system.
Wonderful. It's fascinating, Roland, when you think about it, that it was a pandemic of comorbidities, yet the focus wasn't on the comorbidities. It was almost as if there was only one way out, and we didn't address the fundamental health issues that people were facing.
Exactly. You're absolutely right that most of the victims of the pandemic who disease were actually having some form of chronic metabolic issues, whether it was hypertension, cardiovascular issues, diabetes. All of this were sort of the lead factors towards the mortality in almost all countries in the world. But yet, fear was sort of, I felt, introduced to everyone to fear something that today now they claim it as treat it like a flu was used to get people to be locked down at home. And I think the persecution still exists for those people who have lost their jobs, especially healthcare workers. All of this today, going forward 4 years down the road, we see that a lot of journals, a lot of documents, and the way we manage this has all come to question, Dr. Philip.
Yeah. And so when you think about what happened early in the pandemic there, lockdowns, I guess, were a major part of the approach in Malaysia. How long did they lock down for in 2020?
Wow. Uh, just to begin with, lockdowns in Malaysia, it was much more complex because we had three lockdowns. Three lockdowns. So we had one lockdown in the beginning of March, and that was eased somewhere around June, and then in December, early January 2021, we went into the second lockdown, and then in May 2021 we went into the third lockdown. But we also have to understand in Malaysia it was complex because there was a fall of a government, and there was also politically unstable. So some institutions tried to capitalize on that too during that phase.
So it was a difficult time. I assume that lots of people were sick. There were lots of deaths early on. What was your perspective at that time? Were you scared?
Nah,
Were
I was
you
not scared. I mean, uh, thanks for mentioning that. So one interesting thing that our clinic did provide was concierge medicine. So we are situated at the heart of the city of Kuala Lumpur, and we used to assist hotels around the, we call it the Golden Triangle area in Kuala Lumpur, where you have a lot of hotels and you have a lot of tourists. And then when we started seeing information coming out from China back in November 2019, and they said there is a deadly virus out there, outbreak. We do not know what it is. Guess who were the first people who will be alerted, because we have a significant amount of tourists coming from China back in the year-end holidays. So it's in Malaysia, it's going to be unique. It's going to be Christmas, it's going to be New Year, and also there's going to be the Chinese New Year holiday. So technically, celebrations will start by the middle of December, heading right probably to the middle of February the following year. So we were on high alert. We also were monitoring if there's any of the tourists or guests falling ill, and we will be the first ones to go in to examine them. So we were on high alert at the early infant of this novel virus at that point. But rest assured, but whatever was demonstrated or seen on camera was technically not true. There were no one dropping down dead uh, in those kind of scenarios. Sometimes we think that would have been staged or what. So yes, we didn't see much. We didn't close our borders right up until March, in fact. And for the early year of 2021, we didn't have a huge number of deaths in Malaysia. The numbers were very, very minimal, and the cases were not even in 2 digits, in 3 digits at that point, despite the testing and I would say still significant a good contact tracing system that we had, bearing in mind that our whole country's population is only less than 32 million people. But after the variant of Delta came in 2021 and the rollout of vaccination at that point, we started seeing the spike of cases. So we had at one point, we had even right up to about 12,000 to 20,000 deaths in the period of August right up to about November in 2021.
That's interesting in that so at that point it almost seemed as though it wasn't really until the Delta variant hit that you really started to have a significant impact with regards to deaths in Malaysia. And by
Yeah.
that time, were you guys able to start vaccinating the population? When did that start?
So the vaccine sort of came in by March 2021. It was already being rolled out to frontliners, doctors, military staff, police personnel, government agencies, and then followed by the public. So the public scale up was going on sort of early June, July. It was starting, and then Delta came in, just coincided during the same point, and then we saw this scale. So there is a lot of studies that are showing there's also uh, how do I say, an imprint of vaccination alongside with the virus moving around. If you see like the data in UK, when the maximum projection of vaccines were rolled out, cases started going up also. But we still need a lot more data to verify that kind of complexity.
That's a big topic that I mean I've looked at that. My feeling from my own research, and I think that people underestimate the fact that there is interferon suppression around what happens with the vaccination. And so even though you can see milder symptoms, the case infection rate could be higher, and that would make sense from a scientific point of view. But yes, it's one of those controversial areas that you have to be careful about touching. So let me understand something now about what was happening with you with regards to social media, because that's where you then ran into trouble with your government. So let's take it back prior to 2021. So up until that time, even before the pandemic, were you very active on social media?
Yes, I was. So we've built our social media platform right back in 2014. So we had a Facebook account, we had an Instagram account, we had a YouTube account, and what we did was always to create a lot of educational awareness about issues that we serve in our clinic: metabolic issues, hormones, lifestyle changes, lifestyle modification, tips, etc. So we built a decent amount of following. Like for example, like our clinic page has close to about 160,000 followers locally. Our Instagram page had about almost close to about 40,000 followers. Our YouTube page had about 10,000 followers at that time. So we were already one of the active physicians online, having content. So even during the pandemic, we were also at the beginning, everything was unsure. So we also were looking at the data, the significance, whatever was going on, advisory tips, understanding herd immunity as we speak at that point. So, but then at a certain point, we started realizing like something is not right. The numbers are not matching to what's happening. The recoveries are not happening to what's happening. Then the investigation and the curiosity gets in deeper and deeper and deeper. Uh, I think on my perspective, I'm perpetually maybe a unique kind of physician because I served in the national service or the government as a medical professional for almost 6 years, and 3 years of my service was under enforcement and licensing as a medical doctor. So it's unique where I'm the guy who go and catches doctors or go and do investigative work to see whether there's a grievance management was done properly, if there's any medical misconduct or issue with consent, or patients had a dissatisfaction in private practice uh, treatment that they've got from doctors. So I was trained with all the laws and regulations already uh, in my own country, in Malaysia. So when I started seeing the documents coming out for the vaccine rollout, I started realizing that there was some mismatch between the original insert of the manufacturers as well as the narrative that was put on media, and the consent, the informed consents were not technically the same. So this uh, something that I realized that it was something that need to be questioned in order for them to get it right. In order for them to get it right, not to say that we are there to actually disrupt uh, management or disrupt rollouts of vaccination. We are not against any form of therapy, but we have to make sure that the public gets the right information before they roll up their arms or they
So
roll up.
that's a very important point. So you then, that would have been now moving into 2021 with the
Yeah,
rollout of the
exactly.
vaccine. And
Yes.
so you would have started to ask questions immediately. So straight away, I can imagine you would be targeted by public health because this would damage their vaccine rollout. Were you surprised when you started to be targeted?
Uh, I think I was not. I was not surprised. It was like I felt at that point it was it was almost like a suicide operation. There were few people who were able in this country, physicians were able to do this, and I was not expecting maybe my colleagues who are maybe good practitioners who are able to carry out, to look into the data, to look into acts and regulations, to look into all of this and say that look, something has to be said, something has to change, has something has to be corrected at that point. If we let this go, I even said that in the exclusive recording, which was I think seen by millions of Malaysians, because most of the time I do my content in a local language, which is Bahasa Malaysia, so that Malaysia is a very diverse culture. We have multiple races, so at least the command of the national language is much more better. So I use national language to disperse information. So I realized that, look, it has to be done in order for everybody to start knowing and everybody to start questioning what were they were getting. But I was not saying to them like, look, you should not take whatever medicine. It's always a choice. It has to be freedom of choice. The patient has a choice to consume or think of other alternatives.
And so, what then happened when you started to raise questions? This is where now a lot of people would argue about censorship, but the public health at the time would be saying you are a risk to us, and we can't afford to let you speak. What would you think?
I think you were right. I think the public health saw that I was a risk at that very moment, but they didn't realize that I was looking it at another angle, because what is happening now is what they are going to face for the next couple of years, because the public has lost trust with national systems at the moment, where public has lost trust, public has lost confidence, not just locally, globally at the moment. And this is something that you and I agree that national healthcare systems are very necessary. They are sort of the backbone of the healthcare, even though maybe I'm in private practice, but the national healthcare system has to function and they have to be the ones that people could trust. But unfortunately, today there is a trust crisis globally, as I speak. It's also present locally at the moment.
This is an important point. And when I think about it and I reflect on what has happened, because what we are seeing, and I guess you can confirm if the same thing has happened in Malaysia, in that they were almost, what, 97% vaccinated for the first two doses for adults.
Exactly. Yeah.
But what's happening now with regards to boosters?
So that's a reality of the trust. So we had a 97 moving towards 95 for the first and second shots. We had a variety of vaccines. So it was the Chinese vaccine Sinovac. We had CanSino, a single dose shot also from China, being offered to the indigenous people in rural areas where vaccines were a bit hard to get access. And then we had the more modern versions of Pfizer. We didn't have any form of Moderna in Malaysia, and we also had AstraZeneca. So majority of the population had the mRNA vaccine from Pfizer, and also they had the Sinovac. So it's almost sort of 40-50% had this. When it came to the third shot, people started noticing something was not right with whatever they were receiving, silently maybe. And it was only a 50% pickup on the third shot. And when it came to the fourth shot, almost heading towards 2022, it was only 2.5% of pickup. And then they offered the fifth shot, and the fifth shot had less than 0.1% pickup. So
Yeah.
you see at this moment, the trust is lost. And there were also other things that we were tracking to the parliament, and the losses faced by certain pharmaceutical companies who were told to purchase a stockpile of vaccines, and all of them were discarded. It cost like almost 500 million. And then at this moment, most of the purchase of mRNA technology vaccines were all discarded, and there was also another loss of 180 over million ringgit. So all of these are now all kaput, and they are all discarded at the moment. So it's also, I see it very interestingly as in a perspective of just the economics of health. We bought something which we are not using it, and nobody is taking it up because they feel that it's not going to provide that starling immunity which was promised.
And when you think about what you are seeing in your
Mm.
private practice,
Mm.
and so you're more independent. What
Yes.
are the patients saying to you in terms of their trust? Because you would have been somebody who they may perceive was standing up for them. What are they actually saying?
Okay. This is interesting, Dr. Philip. The biggest issue I see now is actually into pediatric medication, pediatric vaccination procedures have now become a big concern. Since after the pandemic and since after the rollout of these vaccines for COVID-19, there seemed to be a drop in or an overly concerned population regarding to childhood vaccinations. So most of them are questioning every single thing, whether it's BCG, whether it's for tuberculosis, whether it's for mumps, rubella, whether it's for pneumococcal, everything has been now into question. Even though some of the vaccines, even I want to be clear here that we're not against any form of medical technology, we're not against any form of vaccines, but we need to make sure that they are safe for consumption. We need to be really sure whether the benefit outweighs the risk, because there is definitely in medicine there is side effects. We cannot deny that. And I think as physicians, I think the biggest thing that we need to realize that is that when we practice medicine, there is going to be some of our patients, some of our care who we provide care to will have some form of side effect towards the medications, and we need to acknowledge that. The problem we realize that is like physicians don't want to acknowledge it, and they just throw it to the patient, say like, no, you're the blame, you're the rare one. It's not the problem of it's not my problem, or it's not the manufacturer's problem. And they don't even report to the regulatories, or they don't even take responsibility of, okay, let's fix this. Yes, I read through the side effects. Yes, you have this rare side effect in 1 in 10,000 or 1 in 100,000. We need to understand that, we need to acknowledge that.
Yeah, this is something that I think public health or the medical fraternity I've observed across the world are not aware as to how much damage has been done to public trust. And I am not sure if it will be easy to reverse. I usually take the approach of studying what had happened with thalidomide. And after the thalidomide crisis, many countries had to bring in the organizations we see nowadays. The FDA was bulked up. I think the MHRA kind of organization in the UK, because they recognized that the failures of the system couldn't be allowed to happen again. And so this became a serious issue, which I suspect is going to be a similar challenge that we face now. Are the doctors in Malaysia aware of this challenge?
Uh, to tell you the truth, I think there is a growing concern today. I think there is a growth of awareness. There is a growth of note that there were some things which could have been done better if we stood up earlier and express our concerns collectively. Then there would be a resistance or a challenge to the system, so that they could actually go in and get more data out first. But unfortunately, during the pandemic, many draconian laws were used against physicians or used against public who question the national narrative. So that was I think the backfall. I think what agencies should have done is like call up the experts, call up individual doctors or practitioners or scientists who are seeing something different, and say like, what do you have, what do you see, and we want to know whether there's something it can be valid or it can be questioned. Because sometimes in a national system where unfortunately public healthcare or public healthcare specialists, all most of them are sitting down in the national system. So the national system is easily dictated. because you get a stable income, you get promotion, you do not rock the boat. When this happens, like, they can breed down the narrative, just the public easily, and alongside with the media, whether it's mainstream media or whether it's online media. We saw how Facebook, I think a couple of weeks ago, said, like, look, uh, we should have done it the other way. We should have not shadow banned or placed people under misinformation or disinformation, and discredit a lot of physicians who were questioning whatever was going on back then.
And what were the implications for you personally in terms of asking those questions?
Oh, so I was I was called to the police. I was called to the police. I was there was give I had to give a police statement, and then 3 months later, I was charged under the Communications and Multimedia Act in Malaysia, and I was charged under a section for producing digital content which was defined as obscene, not even being specific towards truth or thing. It's just the definition of obscene. So uh, so we went into court trials for quite long, I would say. So the court trials started from 2021 end, and I think I get delayed all the time because of absurd reasons. For example, maybe the public prosecutor had COVID, or one of the investigative officers had some kind of illness. So it's going on, and I'm going into defense this coming September. I'll be going into defense, and I'll be the first one taking the lead. And there's going to be a lot of experts now will be brought in to the trial. We have local experts. We're trying to see whether we can also get international experts to come in, because this is important, where in the future they should leave medical practice to the practitioners and not use such acts and laws to handcuff us in this situation.
It's pretty serious, and I don't know if there are any easy answers, because I think that many public health and leadership people are trying to defend the position that they can't afford to let rogue agents damage the narrative that they may have had for whatever reason. But I think they underestimated the crisis that happened with COVID, because it has now pulled back the veil, in the sense that now patients are questioning everything, and rightly they should, because it indicates that maybe a lot of the things that were being done were not actually as well researched as it had been promoted. And I think that's the challenge that we'll be facing now for many years and decades to come. Any thoughts about that?
Yeah, I think you're right, Dr. Philip, that whatever that has happened will be certainly brought to question. You see, we're not looking at the Spanish flu 100 years ago. Technology has leaped so much. Medical advancements has leaped so much. The way we understand our body has leaped a lot. The technology we use. So we're going to question a lot of things. Plus, with AI and all this kind of technologies to assist us, we'll be able to data mine and analyze more peculiar information and knowledge. And I think the biggest thing in healthcare is to go back to basics again. To go back to basics, go back to the core fundamentals about lifestyle, medicine, the way we think, the way we work, the way we eat, the way we exercise, and not to be feared of the list of diseases that might just come in barrage, but take it with a pinch of salt sometimes. I understand that the core fundamental of immunity, the core fundamental of metabolic issues, the way we eat, the sugar we consume, because if we go on this in this way, whether it's in Malaysia or anywhere around the world with metabolic issues and stuff, all of these immune issues will definitely just keep popping up, because we have to realize that 100 years ago we did not travel this fast. We did not move trade this fast. We did not communicate this much. We didn't have access to uh, another doctor. Maybe you have probably had to use a telegram to get something out. But today we can be sitting here virtually discussing about chronic issues, or maybe get 100 or 200 experts discussing on the go to change our method of approach. So as technology goes faster, but we also need to understand that we need to go back to the backbone and framework of medicine.
I think that's an excellent point, Roland. And so I'd like us to wrap this up with some clear ideas as to, based on what you have been seeing, what firstly do you have to say to doctors who had been silent, and you would say, if we were put in a position like this again, what should they do? And also, what can we say to patients that will help them to be better trusting almost of the system that has probably in some degrees failed them in this pandemic? What are your words here?
That's a great question. It's probably going to be a long one, but I'll try to sum it up. So I feel, as a private practitioner in practice, there has to be a synergy between government and social. That means we need to understand that you need a governmental system that is trustworthy and not biased towards any form of entity, whether it's the WHO, whether it's the IHR, or whatever it is. You see, you need certain international laws. But when you keep deceiving the public now starts to put a lot of distrust and fear. So whether in any law that come in, even in good faith, they're always going to see the dark side of it first, and they're going to harp on it. That's dangerous, because what if in the next years to come there will be another pandemic? Whether it's orchestrated or not orchestrated, that's irrelevant. But if there were proper products, even if there were proper therapies to take, and the disease is lethal, are we going to tell, are the public not going to pick or take the options? This is the dangerous thing now we face this. So we face a situation where they need to understand we need to tango. You need to get something to work. You need the cooperation of the public. You need the cooperation of government. But one has to be really trustworthy. They should not have a lot of interference in the sake of a purchase or contracts given, or they are indulged in because they get grants, they get funding from certain agencies. So the transparency of truth, whether it's scientific, whether it's speech, whether it's preparedness, is going to be the main thing that I think today the world struggles. It's the transparency of truth.
Excellent, excellent. I think that's a great point, Roland, and really, really appreciate your time. I know you're getting straight into work, so I appreciate you
Yeah.
taking some time to talk to us and share these valuable thoughts about what was happening in Malaysia. So thank you very much, and I'll just ask you to wait with me while we do our outro for this interview. And thank you to the audience for being here with us as well.
Thank you, Dr. Philip.